Ladies and gentlemen, may I have your attention, please? Please find your seat. We have no sitting arrangement today. The arrangement is that you choose your seat at the table. So, okay, so please find your seat at the table. I see that there's some seat over there. Please, people at the back, please go forward. Don't leave the seat empty. Please. This is a round table, so there's no hierarchy, there's no order. Please. So thank you very much for all of you to be here at the end of almost the end hour of almost the end of the long week. So there be 3 languages spoken during this meeting. If you are not fluent in all English, French, and Spanish, you can pick up the headset for translation.
Okay, then I would suggest just take the seat and come.
I wanted to move around, but the technology have not supported that. So sorry, I be here because this is empty. We start the conversation. I would like first to introduce myself. My name is Wang Quất. I am the executive director of SCDI. It's the local NGO in Vietnam working with the marginalized community. And I have a pleasure to moderate this section. In preparation for this, I have discussed with the organizer, the Coalition Plus, the Frontline AIDS, the UNAIDS, the WHO, that we will have an open conversation. We will not go to the tradition of having the panelists sitting in front and speak and everybody listen, but instead we hope to have an engaging conversation.
Sorry, Yvonne, I think that the echo is coming because people's headphones are stuck in and we're hearing it through the headphones. So if you're not needing translation, unplug your headphone. That's what we're hearing. We're hearing a backup from that. Sorry, I'm not a technology person, but I think that's what the problem is.
Is it better now? Wow. Thank you. Wow. So we are up to a good start. Okay. So today, we are going to focus on important conversation. It's about how to sustain community engagement in HIV response. all of us who are involving in HIV in the last couple of months have gone through a big turbulence. Let's put it that way. And recently there's a lot of discussion about prioritization, reprioritization of the HIV program. And in that conversation, one of the things that we are concerned is the community response. Community program may not be prioritized. So today we are going to focus on just that topic. How can we sustain the community response, community engagement in HIV? To start the conversation, we will invite the two speakers. The two speakers will speak. Each of them will have 3 minutes. So each invited speaker will have 3 minutes to speak. And after the 3 minutes, we'll invite other people in the room or online to contribute to the conversation. So we're going to have a 3-part. One is to talk about the role of community and the condition for the community to fulfill that role. So that's the first part. The second part is we talk about what have to be in place so that the community have the support they need to fulfill their role. And the third part of the conversation would be what are the barriers and how to overcome that. So let's prepare yourself to engage in the conversation. The panelists, I would say, would be given 3 minutes, but other people in the room or online, please bear with me. You will have 1 minute to contribute. So be very concise. I really hope that it is a conversation, meaningful conversation. And at the end of the day, by the time we leave for the reception, we all feel that we get something from this interaction. So let's start first with my queen, I would say, Magat from ANCS from Senegal. When I start to work on HIV as a baby, as a baby in HIV village, Magat is already there being my queen, and she's still the queen today. Magat is going to share with us her thought about the role of the community and what are the conditions for the community to be able to fulfill that role. Magat will speak in French, so get your headset ready. Magat.
Ok, merci beaucoup, Juan. Je n'ai que 3 minutes, donc je vais faire fi des salutations et dire tout simplement très heureuse d'être là et de rencontrer des personnes que je connais, des personnes avec qui j'ai cheminé, des personnes qui m'ont inspiré dans mon trajectoire et qui ont beaucoup contribué dans ce que je suis devenue aujourd'hui. Et quand je regarde dans la salle, beaucoup de personnes se reconnaîtront dans ce que je suis en train de dire. Ce que les organisations de la société civile ont eu et continuent de réussir sans contestation, c'est qu'ils sont devenus incontournables et très efficaces dans leur rôle. Deux rôles sur plusieurs aspects. D'abord, ce qu'on a su et continue de faire, c'est garantir l'accès aux soins et services et assurer la continuité des traitements. Et pour le faire, on a su développer des approches qui sont des approches ciblées, des approches qui répondent aux besoins des populations, mais des approches également qui permettent de combler des gaps qui existaient. Parce que, comme vous le savez, certes, dans tous nos pays, il y a le secteur public qui intervient, le secteur privé, mais souvent avec des limites dans l'offre de services. Et ce que nous, en tant qu'acteurs de la société civile, en tant qu'acteurs communautaires, ce qu'on a su faire, c'est d'adapter notre réponse par rapport à ces gaps, d'adapter notre réponse par rapport à ces besoins et de maintenir l'offre de services partout et à tout moment. L'autre aspect qu'il faut mettre en exergue également, c'est la mise à disposition des pères éducateurs. C'est important qu'on y revienne parce que pendant longtemps, par rapport à la si on parle du succès aujourd'hui des interventions communautaires, c'est parce qu'il y avait des pères qui sont comme vous et moi et qui ont accepté d'être dans des sites publics, mais être aussi dans des sites communautaires qui ont été créés pour pouvoir répondre efficacement aux attentes des populations et particulièrement aux attentes des personnes vivant avec le VIH, mais aux attentes des populations clés. Et par rapport toujours à cet esprit de garantir l'accès aux soins, je parlerai également du suivi dirigé par les communautés. Ce travail fabuleux fait par les organisations de la société civile permet d'aviser lorsqu'on est en risque de rupture, permettent d'aviser pour montrer qu'il y a des problèmes dans les médicaments, dans les stocks, et pour y anticiper et de ne pas attendre que le problème surgisse. L'autre rôle que nous avons su jouer et pleinement en tant qu'acteurs de la société civile, c'est véritablement tout le travail de plaidoyer que nous continuons de faire et de manière très magique. Ce travail de plaidoyer, c'est d'abord sur les questions de droits humains. Ce travail de plaidoyer, c'est d'abord de nous faire entendre par les gouvernements, de nous faire entendre par les institutions pour qu'effectivement, qu'on puisse accéder au traitement, mais effectivement qu'on puisse accéder aux ressources. Aujourd'hui, si on a su renforcer les enveloppes financières, c'est parce que derrière, il n'y a que des acteurs communautaires qui se sont mobilisés pour pouvoir le faire. Ce travail de plaidoyer aussi nous a permis aujourd'hui de pouvoir régler la question des traitements. On ne parle plus de traitement au nord ou on parle de traitement au sud, mais chaque personne qui en a besoin doit accéder et c'est ce travail-là que nous avons supporté. Le volet important du renforcement de capacité, nous le faisons de manière très, très, très professionnelle. C'est pourquoi aujourd'hui, partout que vous allez dans des pays, il y a des organisations très fortes, mais il y a des hommes et des femmes aussi qui sont très forts, qui incarnent la réponse et qui le portent merveilleusement. Dans nos réalisations, on ne le dit pas souvent, mais nous savons gérer des ressources. Combien d'organisations sont devenues des organisations qui gèrent les ressources, qui les gèrent efficacement, qui les justifient efficacement, mais qui rendent compte également aussi bien aux partenaires qu'aux personnes qui les ont choisis pour gérer ces ressources-là. On ne le dit pas souvent, mais nous savons le faire. Et c'est aujourd'hui encore le moment de dire encore une fois, nous avons besoin et nous avons besoin pour faire ce travail-là de plus de ressources, aussi bien des ressources techniques que des ressources financières. Nous avons entamé un travail merveilleux et ce travail-là, pour pouvoir l'institutionnaliser, pour pouvoir continuer à le faire, ces ressources sont indispensables. Mais lorsque je parle de ressources, je fais un clin d'œil aussi bien pour les ressources internationaux que les ressources nationales. Nous avons besoin d'accéder à ces ressources nationales-là. Peu sont des organisations de la société civile qui arrivent à mobiliser des ressources endogènes. Ce qui fait que les organisations sont souvent tributaires de l'aide extérieure. Et ce changement-là, nous devons l'amener. Nous devons rompre avec des paradigmes pour dire que les organisations de la société civile sont efficaces, mais qui sont reconnues institutionnellement par leur pays, mais qui ne sont pas appuyées et soutenues par les pays. Nous disons oui à la collaboration internationale. Nous disons oui à l'accès aux ressources internationales, mais nous disons également oui à l'accès aux ressources endogènes au niveau de nos pays pour faire la différence. Nous avons besoin également d'assurer la pérennisation de nos organisations. Quand je parle de pérennisation de nos organisations, peut-être vous allez penser que c'est l'organisation en tant que telle, mais non, nous avons besoin de pérenniser ces actions communautaires-là. Nous sommes tous d'accord que les communautés aident à faire la différence, mais nous ne sommes pas sûrs et certains de quel avenir ces organisations auront. Et c'est pourquoi nous aurons besoin d'être accompagnés pour repenser le modèle de nos organisations. Tant que ces organisations resteront des organisations de projet, nous ne pouvons pas parler de pérennisation. Nous voulons que les politiques publiques intègrent cette dimension-là, que des contrats de performance puissent être signés par ces organisations, qu'on arrête de nous limiter à exécuter des programmes au centime près. Nous devons négocier ce partenariat avec toutes les parties prenantes pour que nos organisations soient des modèles économiques pérennes, des modèles économiques durables. Et pour le faire, on a besoin de cet accompagnement, mais on a besoin aussi, nous, en tant qu'acteurs de la société civile, de repenser comment diversifier nos revenus. Comment diversifier nos revenus avec des services payants? Comment diversifier nos revenus avec d'autres astuces qui nous permettent de garantir la durabilité de nos interventions, mais la durabilité de nos actions. Je pense bien que je ne conclurai pas avant de dire que nous savons que des progrès ont été faits par rapport à comment on considère les acteurs de la société civile. Il y a 10 ans, 15 ans auparavant, peut-être nous nous battions pour être sur la même table, autour d'une même table. Mais le combat que nous avons porté a donné ses fruits et aujourd'hui, nous voulons que les donnes changent. Nous voulons des partenariats innovants. Nous voulons pérenniser ce qu'on est en train de faire parce que, quelle que soit, en tout cas, la situation à laquelle nous allons vivre, nous allons continuer à agir. Oui, nous allons continuer à agir, il y a des coupes. Nous allons continuer à agir parce que nous avions agi avant même les ressources. Les acteurs communautaires ont porté des malades sur des charrettes. Les acteurs communautaires ont eu à faire des séances de sensibilisation sous l'arbre à paras. Et c'est après que les ressources sont arrivées. Donc, continuons à nous battre, continuons à maintenir ce combat-là parce que nous allons gagner. Merci beaucoup.
Wow, that's a powerful remark. I don't pretend that I need to summarize that, so I'm not going to, but I like what Magat spirit, like we work before having resources, right? So now there's some cut, this challenge, but it's not going to stop us. But Magat clearly outlines the role of the community and the condition. And according to Magat, what I get is that it is a time for us to reflect and go to the next level. It's a organizational sustainability. They need to be institutionalized. They need to have a public policy and public law and so on to make it sustainable into the future. So we have heard from Magat, represent civil society and community. Now we would like to hear from the other side of the table, from the government. So what the government think about the role of the community and what are the conditions to sustain this role. I would like to introduce Dr. Adrorio Barreira from the Ministry of Health of Brazil. Yes, so really, on the other side of the room, but we are on the round table, so please.
Thank you, Anne. Not easy to talk after Magat. Very strong speech. I could speak by heart about this subject because for us it's so present in our Brazilian response, but I will be a bit more formal and read because I don't want to forget any word. Brazil welcomes this timely discussion. I think this is the thing to do at this time, as we meet under the shadow of severe aid cuts and the erosion of civic space globally. We must reaffirm a simple truth. There is no resilient or secure health system without communities as its core. Since the early days of the HIV epidemic, Brazil's national response has been built with and by communities. People living with HIV civil society organizations, and academic institutions. This model has always been a matter of public policy and constitutional rights. Preserving and scaling community-led system is not optional, it's urgent. Brazil has institutionalized community leadership through formal representations in decision-making bodies, through social contracting for service deliveries and prevention, and through co-production of knowledge with universities and public research institutions. Awareness campaigns and PrEP rollout strategies differentiate care models. All were shaped by civil society and have proven essential to reaching the most vulnerable populations. In our case, community leadership is not project-based. It's part of the health system. And that's why we are concerned. Global cuts are putting this model at risk, especially in low and middle income countries. We echo the call to create and expand social contract mechanisms, protect community institutional capacity, reform regulatory frameworks to integrate community action into resilient systems, ensure dedicate predictable funding for community-led responses in the next global AIDS strategy. In the face of the growing HIV fatigue and the multipolar crisis we are living through, we must not lose sight of the structural role that communities play, not only in HIV, but in pandemic preparedness, mental health, and primary care. Brazil remains committed to support community leadership as a political priority, not because it is easy, but because it's effective, democratic, and necessary. Thank you.
Well, thank you. I know why Brazil don't need a lot of donor funding, and you still have such a strong program. And it is a role model for country to follow. And I hope every country can be like a Brazil. So not project-based, but really institutionalized to become a part of the health system, have a regulatory framework that the community become, there's a formal presentation of community in the decision-making body. You have a social contracting to make sure that the funding is there, predictable and sustainable and everything. So I think this is a great example from Brazil. Thank you so much. Now I would like to open the floor for contribution in this conversation, the role of the community and what are the conditions for the community to be able to play that role in HIV response. So for the people in the room, put your name tag up so that I know you want to speak. For the people who are online, please raise your hand. So who want to contribute? Who want to get 1 minute? Yeah. Yeah. Thank you. So Colombia, please. Would you mind to introduce yourself and then it delivers your intervention? Thank you.
Ok. Gracias. Soy Jaime Urrego, viceministro de Salud de Colombia. Gracias por la invitación. Primero, agregar que en el contexto no solamente está el recorte, sino una ideología y una narrativa antiderechos. Una ideología, una narrativa en contra de las luchas de las mujeres y de todo lo que significa el enfoque de género y la construcción de lo que ha sido toda la experiencia de las personas viviendo con VIH en el mundo. Por lo tanto, la tarea no solamente es financiera, es también política e ideológica y requiere de la movilización social y del fortalecimiento de la democracia y de las alianzas regionales. En segundo lugar, constitucionalmente la participación, para ir al punto de la primera sección, está consagrada no solamente como la exigibilidad o la garantía de un derecho, sino como protagonismo también en la acción. Nosotros estamos avanzando a partir de un compromiso que también hicimos en este recinto hace 2 años, para que el nivel comunitario el componente comunitario del nivel primario de todo el sistema de salud sea realmente algo estructural, no marginal, no aleatorio, sino que recuperemos el valor de los saberes de la organización y de lo que significan los principios de la rehabilitación basada en comunidad, en donde la participación debe ser integral. Entonces, hoy en ese contexto se vuelve fundamental no verlo como algo marginal o la extensión de un servicio, y mucho menos como un ahorro para bajar los costos de la atención integral. Al contrario, la participación comunitaria es calidad, es dignificación y debe ser protegida y debe ser financiada. Y tercero, agradecer a la sociedad civil, a ONUCIDA, al Fondo Global, que Colombia tomó la decisión de expedir una licencia obligatoria para el dolutegravir como medicamento de primera línea en Colombia, lo cual, como ustedes saben, genera presiones por parte de los actores corporativos, pero el respaldo a nivel mundial sobre esta decisión de soberanía sanitaria ha sido importante y queremos agradecerlo el día de hoy.
Thank you so much, Deputy Minister. I think it's really nice to hear somebody who's so high level in the government to thanks community and to say that it's not just a nice thing to do. It is something we must do. Having the community become a part of the structure. So the second time I heard the word structure from the two people in the ministry. So government officers saying that community have to be a part of the structure. That is really, really important. Thank you for reinforce that. Is there any other person in the room want to speak? Okay, yeah, please. I don't see very well, but you can introduce yourself. Go ahead.
Un saludo para todos y todas. Soy Cindy Marcela Zapata, también soy de Colombia. Hago parte del mecanismo coordinador de país y represento allí las organizaciones de base comunitaria. Esta conversación es súper importante porque se hace necesario poner sobre la mesa también la mirada de las organizaciones de base comunitaria, en donde la pregunta es cómo vamos a continuar, ¿sí? Y considero desde la experiencia que tengo que es importante seguir apostándole a que los países le den un lugar a las organizaciones de base comunitaria desde el reconocimiento, desde la contratación social y desde que se generen menos barreras para que podamos seguir haciendo nuestro trabajo. Siento que en muchos escenarios hay diferentes obstáculos que imposibilitan desde lo financiero, desde lo técnico, poder llegar aún más a las comunidades, y es necesario que desde este lugar donde hay tantas personas que ejercen cargos tan importantes, nos llevemos la conciencia, la necesidad de que la voz de las organizaciones de base comunitaria requiere más acompañamiento, más espacios de participación y más diálogo con los gobiernos. Gracias.
Thank you so much. That to say that we need to, the engagement is not one-off, right? It's not that you invite the community into the CCM or invite the community into some of the decision-making body that everything would be solved. The dialogue should continue to remove barrier after barrier to have a better working mechanism. So thank you very much for highlighting that. Now let me move to the next conversation. So we heard about the role of the community, ensure the access to services, support the continuation of treatment and adherence to treatment, advocacy, doing the COM, community-led monitoring, doing the advocacy, doing capacity building. So all the important critical role to make sure that the HIV response is effective and can reach to the people most at risk of HIV, most affected by HIV. We also heard about the condition that need to be there so that the community can play their role. We need to have resources, technical resources, financial resources. We need to have a structure. We need to have a community to be in the structure. We need to institutionalize the community and the program of community. And we need to continue dialogue to improve the partnership. We heard that community should not be just one-off, should not be project-based, but being a part of the system. Okay, so now, what do we have to do to make all these things happen? What have to be in place so that community have enough resources? Is the community being a part of the system? They be social contracting. They are being a part of the decision-making body. So I would like to invite two people to start this conversation, and you can. Each of you also have 3 minutes. You can give concrete example of your country, or you can give the outline of what you think is needed. First of all, I would like to invite Anusia from Malaysia, from Malaysian AIDS Council. Anusia is also the member of the Developing NGO delegation to the Global Fund board. Go ahead, Anusia.
Thank you, Juan. So just to give you a glance of HIV situation in Malaysia. So it's declining by still significant among key population, most of the disproportion among key population. And national HIV response are funded by government for more than 90% of national HIV response. But this just not about services, just not about life-saving medicines that provided at the primary care center, but also how to access the people to get access to that medicine. So civil society plays a very important role in ensure that the services being brought to the key population, and so ensure that key population reach to that life-saving service, interventions. And with this, like what Malaysia is doing is social contracting, which is a key mechanism for sustainability, and for mostly to engage civil society, and also to run a prevention program through community-based organization and also local NGOs to run prevention and care services. And the social contracting is also important to strengthen community systems, health management information system, monitoring and evaluation. So these are all important key part. And also with social contracting, you're able to deliver innovative service models, including community-led responses, differentiated HIV services for key population. So, but at the same time, we must ensure that human rights and gender are protected as well. So the program for human rights and gender are protected as well. So, the social contracting is important, play important role to ensure services have been reached to the key population, hard to reach key population, and also those who are really in need. And the second thing is build partnership. So as Malaysia is currently under the transition process of Global Fund grant, so it's really important to enhance domestic financing to ensure that we sustain community responses. And with partnership with the tripartite partnership, which is between government, NGO, and private sector plays a vital role, because this is not about task shifting, this is about task sharing. It's everybody's commitment to ensure we end HIV. So make sure that all these partnership happens, and we also in a way of ensure that with all this sustained partnership, we can reach for those services, people who really need in unreached places and also unhidden in hidden population as well. So just to mention that community-led responses and differentiated service delivery is important with social contracting and also with tripartite partnership between NGO, government, and also private sector. So I want to specify that local NGOs. Thank you.
Thank you, Anusha. I would like to follow up with you a little bit. Sorry to put you on spotlight, but what often happen is when we use a domestic resource for social contracting, the issue like human rights or gender may not be prioritized. What happened in Malaysia?
Okay, I would say ours is not a perfect system, but we are working towards to ensure that we somehow reach, because health is human right. So we ensure that people access to health. That's the basic thing. And definitely gender, also we are working towards to ensure that all the key population have safe space, and of course with community-led responses, it ensure we reduce the stigma and discrimination when they access services to the healthcare centers, and to ensure with the community system, with civil society, they will ensure that people get treatment, people get services without judgment. So that's important. I know that we still working towards to ensure that the human right and gender are protected, but as I said, we still not a perfect system, but definitely working towards to it. Thank you.
Thank you, Anusha. I have a million questions for you, but we don't have time now, so it have to be our private conversation, our side conversation. I would like to invite the intervention for the same question, and this time we would like to hear a response from UNAIDS. So as a global leader of the HIV response, what do you think needs to be in place to in order to ensure that the community can play their role? So we have Christine, the Deputy Executive Director of UNAIDS, will share with us. Go.
Thank you, Juan. And thank you, everybody, for coming here on this almost last day of what feels like a very long week. I will also not do any protocol, but I want to point out the member states that have joined us all here today. So I want to acknowledge Colombia, Brazil, Zimbabwe, and I think I see the Netherlands. And there might be others that haven't put up their name tag, but it's important that we acknowledge that we're not just having a conversation with ourselves, but we're having a conversation with the people who can actually make that happen for all of us. So I just wanted to appreciate that you're here tonight. So I also only have 3 minutes, and as Magat, I struggle with 3 minutes, but let me just point out a few things. First of all, a lot of the conversations this week and the last few months, as one has said, have been about how do we get new resources, different resources, because we're finding ourselves in this very, very complicated situation. Some countries in a more complicated situation than others. I'm not going to go through all of this, but I do think we have all agreed that there is going to be a shift. We will have to rethink what we do. But at the same time, we must acknowledge that when all is said and done, and when we have figured out how we get better domestic resources to all parts of the response, including to the community response, there will be something that is left that was probably for some time needs donor support. And I think we do need to keep on saying that to donors. You know, we are willing to change, we are willing to think about doing things differently, but we really need to ensure that we don't lose that support. And that's important for two reasons. One, for financial reasons, but also because that support has also driven our global solidarity over many, many years. And I think I don't want to forget saying this before I start saying something about domestic fiscal space. But then secondly, yes, and I think, you know, today alone, I think I've been in 3 panel discussions about creating different space for countries to take up responsibilities themselves. And I think we're seeing some good movements there. So for communities to be part, or for the AIDS response to flourish, we do need to create this different fiscal space. And that looks differently in different countries. Many of you around the room have done work on this. It is about differences in taxation. It's about finding ways for debt relief. It is about all those things. But ultimately what we're saying is, and it's also about how governments make decisions about how they distribute and how they utilize efficiently the resources that we have. So we know that for whatever we all decide and we agree, we need to have this different fiscal space. And I think we want to go back a little bit to the beginnings. Magat talked about some of those elements. How did we get to where we are? We demanded from the global community to make resources available, to reduce drug prices, to get communities involved. We made those demands, and many of us have done it at national level. Many of you are doing it at national level, but maybe there's a time for new partnerships to really think, do we have to connect with others in our communities to think about how we make arguments about that fiscal space, so that we team up with other actors that are actually demanding from the government for better resources and better allocation of resources. I think one of the issues that we are all struggling with at the moment, and some of you are struggling less, I think, than others, is what does a community-led response and systems, how do they look like when they're fully integrated into government systems? Ultimately, that's what we want, right? We want to make sure that all the services that we're talking about include community services and are resourced as such. And I think it's really important, as has already been said, that we're talking about community-led and not community-based services. Because what we often end up is governments very quickly retreating into community health workers who are not necessarily the same community members and peer educators and people that do all that important work that we are talking about. So we really need to insist that we're talking about an infrastructure that we have built over the years that allows us to reach the people that need to be reached. And so that those systems inform the data that is used, our data. Magat talked about community-led monitoring, so that governments make financial decisions, resource allocations, and policy decisions that is driven not only by data that is generated by government, but also by communities. For that to happen, we need civic space. We are seeing at this particular moment that we have more and more restrictions on civic space, less of an ability for communities to speak out, less of an ability for people to register. Those are the kind of fundamentals that need to be in place before we even talk about integration and community infrastructure. You know, in the last few days, people keep on making these remarks about, you know, we need to do more with less. And I think all of us in the room are very determined that we don't want to do more with less, but we want to do differently with less, right? That is our reality. So we need to collectively figure out, how do we do differently with less? And as we have observed, and I hope some of you have seen the documentation we have done together with many of you in the room about the impact of the recent cuts on health responses and HIV responses, what we're seeing who's most affected are prevention services in communities and community systems. So we do need to come together and really think strategically about, what do these services really have to look like? How do we reach marginalized populations, and what maybe in the end might be left that can't be taken over by a government, even integrating communities into that government response. And then we need to figure out strategies of how do we resource that. And I think that's where we have to get to the conversation about the private sector. I think several of you have already said it. And I think that needs a new advocacy strategy also from everybody to say, look, you need to be part of this, and this is how you can be part of this. So it's a different kind of partnership I think we need to create in this new era. I heard a lot of you talking, and I'm really glad that, and I know it works well in some countries. In Brazil, for example, social contracting is successful in several countries. Malaysia is a good other example. But we also know that social contracting is really challenged for exactly the reasons that Juan has just pointed out, that often when governments agree for social contracting, what we are losing is the honest voice in the room, the human rights advocacy, the speaking out for those who are most marginalized in communities. So again, is social contracting always the best model? Maybe there are different models, and maybe we haven't been innovative enough, and maybe we haven't been pushed enough to think about those. And I think it is for us collectively to really think about that in this new fiscal space, maybe with increased domestic resources, whether they come from governments or from the private sector. What do those mechanisms look like and modalities look like? And then maybe a last thought is that I think it's really important as UNAIDS, we do a lot of these, and we're trying at the moment in a turbocharged kind of way to provide guidance about what some of these models and minimum standards could look like. But at the same time, we are also really aware that it looks really differently in different countries. So what works in Brazil might not work in Zimbabwe. What works in Zimbabwe might not work in Senegal. But what we can offer is to think about what at a very minimum needs to be there, and how can that then be shaped in a different way, depending on the country context. I leave it at that. Thanks, Juan.
Thank you. I can see that you struggle with 3 minutes. But well said, because all these things are really important. And as we, Christine have said that very well, we need to do differently with less, probably less, not sure less, but one thing we know for sure that we need to do differently. Today, when we discussed about organizing this section, we agree that we are not going to talk about the impact of the current cut and what happened with the community. We get over it, right? We like Magat said from the beginning, when we start to work on HIV, we didn't really have funding. We have nothing. We have a lot of stigma. Instead, we have to, when I remember I visit a family living with HIV, I have to almost like disguise so that nobody know that's a stranger visit the family, because that may bring stigma to the family. So I think we are in a different place now. We are in a much better place now. It's not as good as we want, but the current crisis make us have to think differently and to work differently. So in fact, it's an opportunity. We can be optimistic, as I think we are all. We are resilient. And in order to be resilient, we have to be optimistic. We always see the positive side from whatever situation. And here is the conversation is exactly about that. So now I would like to use a few minutes left for this part to invite the intervention. What do you think need to be in place to sustain the community engagement? So from Panama, do you want to introduce yourself and your 1 minute start?
Hello, everyone. I hope you're all amazing. My name is Jose Acevedo. I am the youth delegate from Panama right now. And I wanted to get the courage to speak about this topic because I think that youth is really affected by HIV, and it's one of the main populations that we have to tackle. It is confirmed that about 28% of the new cases of HIV are in youth people from 15 to 24 years old. So in this case, talking about how to implement resources and how to develop strategies to seek key population, it is important to develop educational activities, and SRHR is something that needs to be improved in every single country. Education can be given for free. It's our way out of everything. Improving our mechanisms in SRHR like focusing on youth people, focusing on the ones that really need to know how to protect themselves, how to be like protected about what can happen. It's the best thing that we can do. So I think that we need to advocate for improving better SRHR policies in our countries that could be helpful for the youth and also for everyone in general. I also think that the healthcare, like the workforce, need to be like educated too. I am a medical student. I'm almost finishing, and I know that we learn HIV and we learn the science. However, we don't learn how to treat fairly an HIV patient. We don't learn how to like speak with a patient that's in a really like, but that could have like mental health problems. They could be affected by this. HIV, it's like we need to be capacitated in how to treat with patients and how to deal with these situations. So yeah, that's my part of it. And I think that it's important that you'd raise their voice in topics like this.
Yeah. Thank you very much. And when I was a medical student, HIV was not discovered yet. But I learned about HIV from people living with HIV. So maybe for medical student and education of other students, the community can have a big role. So I hope that you may find some model, some program to engage with the community to educate medical students and other students so that you can become a better health professional. So thank you. 1 minute and please introduce yourself.
Hola, muchas gracias. Mi nombre es Fernández Álvarez, soy un hombre trans de Colombia. Bueno, para mí y pues para mi comunidad es muy importante que fortalezcamos la cooperación técnica y financiera entre la OMS, entre la Organización Mundial de la Salud y en general la comunidad internacional y los países que enfrentamos contextos regresivos. Como lo mencionaba ahorita el viceministro Colombia, en este momento contamos con un gobierno progresista, pero lamentablemente aún vivimos en un contexto regresivo donde hay una oleada de sectores antiderechos, especialmente frente a poblaciones clave, como lo son las poblaciones trans, por ejemplo, que enfrentamos mayores riesgos y mayores impactos ante iniciativas, por ejemplo, iniciativas de leyes en este momento en Colombia que están buscando quitarnos derechos que ya hemos logrado, que ya hemos conquistado. Entonces, realmente como algo necesario es esa cooperación técnica de esta red global y también la cooperación financiera teniendo en cuenta también a las organizaciones de base comunitaria, a las organizaciones civiles que son quienes enfrentamos día a día las consecuencias de estas políticas regresivas. Muchas gracias.
So thank you very much. And I think, of course, there are things to be improved, but the fact that you are here and you speak, that is a very important first step. So hope that you continue to speak your voice and work with other partners in the country to improve. So we have a college over there, please. And I know that there's somebody at the back want to speak, but can I invite people to come here because for technical reason, there's no mobile wireless mic. So people from the back who want to speak, please come here. And I invite okay, you are already on the table. Yeah, please. Sorry. Yeah, go ahead, Joe. 1 minute start.
Okay, thank you. I'm happy that I will not move again to to speak. I'm Joseph Watto. I'm from Cameroon, called the continent. I rule the coalition of civil society working on health financing and universal health coverage. Maybe I really like the conversation that we have today, and maybe for me to express myself well, I would like to take it in French so that I don't miss any words, you know. En fait, ce que je veux bien comprendre, c'est que nous sommes dans une période où on se bat beaucoup pour parler de société civile, communauté, ainsi de suite. Mais on se demande bien c'est qui les communautés, c'est qui la société civile dont on parle. Si on regarde un peu en arrière, je vais dire que lorsqu'on est dans une communauté et en ce moment-là, on est société civile. Mais quand on grandit, on a un emploi dans le gouvernement, on commence à être séparés. On dit, ceux-là sont société civile et ceux-ci, nous sommes gouvernement. Et ça devient comme si ceux qui sont maintenant société civile sont des ennemis du gouvernement et ceux qui sont dans le gouvernement ne connaissent plus, ils n'ont rien vécu lorsqu'ils étaient dans la communauté, lorsqu'ils étaient société civile. Ce que je veux dire par là, c'est quoi? C'est qu'en fait, on ne devrait pas avoir une séparation société civile-gouvernement parce que dans la réalité, c'est une question de mentalité. Avant d'arriver à la position de gouvernement où tu prends les décisions et autres, tu as d'abord été société civile. Et donc, tu devrais comprendre les réalités de là où tu as vécu avant. Et ça ne devrait plus être un plaidoyer qu'on devrait mener pour qu'on dise que community, vous devez venir vous défendre vos positions, vous devez venir faire ceci ou cela, parce que ça devrait être naturel, ça devait venir lui seul, parce que c'est quelque chose que nous avons en nous. Nous avons vécu en communauté, nous vivons avec des gens en communauté. Les questions de human rights, gender et autres, ça ne devrait pas exister parce que nous les voyons avec nous, nous vivons ça tous les jours. Et donc, lorsque nous prenons des décisions, nous devons considérer ça sans plus attendre que les communautés viennent et commencent à se battre que mettez tel point ici et mettez tel point dans l'autre. Donc, évidemment, je suis très heureux qu'on discute aujourd'hui sur ça, mais je voudrais qu'on prenne conscience du fait que il n'existe pas de société civile ou bien de communauté parce que si nous regardons, nous sommes tous communautés, nous sommes société civile et nous devons donc changer de narratif, nous devons changer de mentalité et commencer à voir les choses autrement en regardant que nous sommes tous d'une même communauté. Merci.
Thank you very much. I can hear your frustration and disappointment to some people come from the community into the government and pretend that they are no longer being a part of the community. But I think not everyone like that. We have a very, very good people coming from the community in the government position, in the UN, in the different important position, and understand community well, and being a part of the response, playing both roles, or even if they play the role of the UN officer or the government officer, they, with their deep understanding of the community, they contribute a great deal. But the bottom line from what your intervention is that we need to work hand in hand, right? We shouldn't separate. This is community, this is government, but we are all in it together. So I think the point well taken. There's a question from online for Christine. Also for people online, if you can select the channel for the language that you are familiar with, there's the button in the Zoom more for interpretation, so you can choose the language. So for people online who have not familiar with that. Okay, so the question from the person, there's a college online, Emmanuel, is it possible to clarify what the UNAIDS panelists mean by minimum standard? So, Christine, if you can do in 1 minute, would be great. Thanks.
You will stop me, Juan. You know me well enough to stop me. Yes, I think as we are thinking about, you know, as I said, really turbocharging, thinking about integration and thinking about integration in a way that maybe we have considered in the past as something we would, you know, we are striving towards. Now we are seeing many, many countries, governments are forced to integrate services and integrate programs because there aren't enough resources. And this is being pushed more and more. So we are thinking here about how can we be helpful in, as the Joint Program on AIDS, to think about what would be minimum standards that we would help people to guide them to say, as a minimum, when you are doing this integration, this is what we want to see happening in terms of integrating communities. So we're still thinking about that. There are different pieces of this around, but we feel like we need to consolidate it and work with communities and civil society to come to something meaningful that helps us in those conversations with governments at country level as that integration is going ahead. And it's no longer becoming an ambition, but it's becoming a reality.
Thank you, Christine. So it's the minimum standard for integration. And I would like to suggest that in that conversation, you have government as well. Yeah. Now we move to the last part of our conversation is about the barrier. So, I mean, we talk about wonderful thing, fiscal space, minimum standard, structure in institutionalization, become a part of the system, etc. But we should anticipate the challenge, the barrier, and we have met Dorothy from WHO who leads the HIV viral hepatitis STI at WHO, who is going to open the conversation. So Mac, you cho 3 minutes start.
Thank you. And I was hoping that we would have the representative of Cote d'Ivoire to set us off, because it's always difficult from WHO to be imagining that we know all the barriers and that we know any of the solutions. But I want to be able to try to bring something a little bit different to the discussion if I can. I think the one thing I noted in many of you who are at the Global Fund Board is how quickly, when we're thinking about reallocation of grant, deallocation of activities, prioritization, how we heard how community-led services, community-led monitoring, stigma index, all of these were dropped to keep ARVs or life-saving interventions on the pathway. And I think it was something that woke up to me how quickly it happened within a week, that people were not employed anymore on that kind of work, and how perhaps we need to do a better job when we start to see that kind of activity happening to say, we can't have life-saving interventions for HIV or any other healthcare without the commodities, without the biomedical, and without the community to be able to, and people living with HIV to be able to do the delivery. So, or the other activities, the monitoring, the engagement, the education. So in many ways, it was a wake-up call to me that the barriers are also us and how we define what's life-saving. So that's one thing I think we need to change, and we're starting to change. And I think from the Global Fund Board already that has been changing as we think about what's essential services. The other thing I wanted to bring up is this week at WHO, there was a historic pandemic, the pandemic agreement that was endorsed. And if you look through that critically, there's an element of community. And I was with some people from the emergencies, and we've worked, many of us, on both COVID and Mpox, and that we know outbreaks, problems, emergencies, humanitarian issues, they are first identified in communities. The response first happens with communities in terms of action, in terms of the first line of defense, in terms of recovery. So that kind of acknowledgement that everything we do is revolving around the people with whom the disease process, the disease, whatever is happening, happens in communities and is solved by communities, is something that we need to bring to our programs as we move forward. So I don't think I'm going to say too much that's different from what are the approaches to these barriers that we're seeing. Not only do we have to educate ourselves and be really cognizant each time we think about prioritization in this difficult setting, but also to think about what the opportunities are. And I do like the idea of formal integration of institutionalization, but I do think that it's quite important that it's not, it has to be on an equal basis, and also that fighting sometimes is not the best effort for all, but being close to the government and working with government and offering a service to government which they need? Is it going to be the last mile service delivery arm, et cetera, and being adequately recompensed for all of that? Because it's work, and every volunteerism really shouldn't exist anymore with CSOs or communities. I don't think I'm any much of an expert on innovative financing, social bonds, et cetera. I hope all of these things work. I don't know if they work. So I think what we need to do is be able to monitor these, have monitoring systems to know, is quality maintained? Are these social contracting bonds, investments actually ensuring that community-led responses are continuing? And then lastly, perhaps telling greater stories about on these, not just service delivery, but also the building the trust in community, what our youth said, bringing the energy of communities to young people, showing better accountability, system accountability. We hope that that would be an approach could be taken to overcome some of these barriers. Just to say, you know, we're working on trying to bring in new guidance, new guidelines. There is no way we can bring in long-acting PrEP or any of the new innovations without community services and community monitoring and community activities happening and doing that hand in hand. So better demonstrating, documenting, and ensuring that as we prioritize and reprioritize, that there is an element continually in the work plan that is all about community engagement, community-led services and responses. Thanks.
Thank you so much, Meg. What you at the beginning of your statement, you pointed out a sad reality, which is that the community contribution are often undervalued, not recognized enough, considered as nice to have, but not critical, not crucial. It is wrong. I also at the Global Fund Board meeting, and I could, but what I find very encouraging is that the board, I would say on delegation, recognize the role of the community. HIV is not a normal disease. I mean, no disease is normal, but HIV is such a special condition that without community engagement, you may not be able to sell the service that you have. You can have the most beautiful clinic, you can have all the equipment and medicine, but people may not show up for you. So, so that is really important role of the community that the Global Fund Board recognize. And I hope that that recognition would be translated as the Global Fund going through reallocation, reprioritization. And we should continue to advocate for that, to make people realize that, oh, medication is not the only answer, but the community engagement is a part of the answer. I see that there are hand raised from Brazil. So it's great to see the great presentation of of Latin America here, because in the meeting, in the global meeting, we don't really see the Latin America very much. So thank you, government and civil society. So yes, please, Madam. Yeah, Brazil, 1 minute for you. I think she's going to speak in Spanish, so you can get your headset ready.
Olá, sou Fernanda, estou na presidência do Conselho Nacional de Saúde do Brasil e foi muito bom ouvir Draulio aqui, que traz todo o trabalho que o governo vem fazendo no país, mas é importante destacar que desde a década de 80, muito se fez em parceria com o movimento social organizado. Temos, inclusive, no Conselho hoje, que é uma representação do controle social, da população, das comunidades, muitas entidades sobre o tema, inclusive uma que destaca a questão do cuidado através do gênero. Então, temos uma ONG, uma organização não governamental, que se chama Cidadãs Positivas, que fazem aí todo um trabalho bastante importante para o cuidado também no recorte de gênero. Esse painel é muito importante para que a gente possa divulgar ainda mais essa ação entre os trabalhadores, os usuários do Sistema Único de Saúde e a gestão, os governos, na referência direta de que precisamos cada vez mais avançar no cuidado, no sistema de saúde que garante toda a estrutura farmaco, toda a medicação, mas também na inserção da vida no cotidiano da sociedade, rompendo os preconceitos. Então, era esse o registro que eu queria fazer da importância da ação do governo com a sociedade, uma parceria potente para o enfrentamento nesse tema na sociedade brasileira.
Thank you, Madam. Now you will have translation. So, yeah, because we need to have a translation from Portuguese to Spanish, and now you will get the English translation. Yeah, or French. No. Yeah. Yeah. Okay.
Laura também
Yeah.
quer falar.
Please.
¿Explique yo? Ok. Yo soy Priscila Torres, represento acá al Consejo Nacional de Salud y yo voy a ser parte de lo que contó Fernanda Magano, que es la presidenta del Consejo Nacional de Salud de Brasil. Nos encanta mirar que tenemos acá en esta cita los compañeros de América Latina. Por eso estamos hablando que todo lo que nos contó el doctor Drauzio del Ministerio de Salud de Brasil es parte de un trabajo colaborativo donde las comunidades están integradas con el gobierno y así podemos hablar con el gobierno con paridades de participación acerca de los sistemas de salud, lo que necesita la población de nuestro país. Hablamos con nuestro gobierno a través del Consejo Nacional de Salud, a través de los consejos de salud en las provincias, en las ciudades, donde está lejos, tenemos un consejo y tenemos la comunidad hablando con el gobierno, lo que necesita y cómo lo necesitamos hacer. Hacemos parte de una participación ciudadana que mira las políticas que sean cada vez más incluidas las poblaciones y sus necesidades. Por eso estamos acá muy contentos de mirar que tenemos distintos países y que América Latina también aquí está y nosotros estamos disponibles para hablar con nuestros compañeros y hacer parte de lo que nos cuenta la resolución de participación ciudadana de la Organización Mundial de Salud en la última asamblea de 2024 y nosotros tenemos muchas ganas de trabajar juntos con los países de América Latina para hacer que ese cambio de los sistemas de salud sea también participativo, así como lo tenemos en Brasil.
Thank you very much, Madam is the president of the National Health Council in Brazil, and you probably also know that at the moment there's also movement on universal health coverage, and in some countries there's a National Health Council, National Health Assembly that happen, and it would be really great that in the community can be a part of that as well. It's not only that HIV is a part of the whole health response, universal health coverage, but community is a part of the decision-making body, which is National Health Council or National Health Assembly, like it's happening in Brazil and some other countries. So it's very encouraging to hear. And Madam President, I'm sure that you will make sure that community affected by HIV being a part of your decision-making body. Now, there are several people who want to speak, but please allow me just invite the last people to give intervention for this part, just because they raised the flag first. It's from the Global Fund. So, cho 1 minute start. Can you introduce yourself and deliver your 1 minute? Thank you.
Try in 1 minute. Vuisega Dubula from the Global Fund. I'm going to stick to one point. I had 3. Whether we have we are aligned on what integration we want and what integration are we talking about? Because I think integration means many things to too many people, and everybody is talking about integration as if it's the same thing for all of us. And I'm raising this because in the context of an anti-gender and anti-rights movement that already has infiltrated all parts of society, including the health system, integration in the current way where criminalized populations are not able to access services, it will cause harm. So what type of integration and normative guidance should we give to governments today to guide what type of integration should happen in a criminalized environment? Because if we just allow just governments alone to integrate without thinking about the types of harm that can be caused to populations who will be reported by community health workers, by health workers, because they have to go to a public health system that can report them. Is that responsible integration? What should integration look like in an environment where community health workers are not institutionalized in a health system? What are we proposing to government? Are we proposing an absorption of community health workers paid by government? What exactly tangibly are we asking? Also, community itself, governments, if we are going to be integrating, they don't trust. We don't trust each other. There's also no risk appetite. So are we talking about community-led organizations integrated? Are we talking about international organizations who have systems who will be easily integrated, because those are the ones that the government trusts? Can we just talk about those things that we don't want to talk about tonight? Because that's the integration we're going to get. We're going to get an easy integration for those organizations who have systems, not the ones who are still building, not the ones who keep being hit by crisis after crisis, who don't have resources to withstand all of these crises. That for me is what will help, even in the Global Fund process happening now, to say, if we are enabling and catalyzing integration in countries, here is what the package. How should it look like in a criminalized environment? How should it look like in a non-criminalized environment? Then it's practical. Governments know what to do and we can support them. That for me would help me just on the integration. I'm not even talking about other challenges that we are facing.
Wow, that is powerful and is very well said. We should, and I hope that will be reflected in the minimum standard of integration that UNAIDS is going to develop. What is the minimum in that integration story to make sure that the population who are criminalized or stigmatized are safe and can access service safely, if not in a welcoming manner, but at least in the equal rights as other people. So I think that would be a very, very big challenge, but it's very critical if we are talking about integration of the community into the government system. Okay, so we have an intervention from online. We have a Dr. Fares Abdullah from South Africa. He's going to share with us his reflection from this conversation. So, Dr. Abdullah, the floor is you. You can unmute and speak. Great, thank you.
Thank you very much. I'm very happy to be joining a meeting with Meg, Vuiseka, and Magat. Magat, c'est vraiment un très grand plaisir de te voir après presque 20 ans, je crois. I know we don't want to talk about the PEPFAR cuts, but actually it's a very important contextual issue for my very brief input here. As we know, the PEPFAR cuts have not only been on a large scale but the brutality of them really is in the precipitous nature of the cuts. And I just want to quickly pay tribute to activists in the US who've been right there on the front line protesting against this. So as we speak, we have a debate in our parliament right now as we speak, and that is about replacing PEPFAR funding. And one of the debates is whether that replacement funding should go to government to pick up the services that are being lost because of the PEPFAR cuts, or should they go to NGOs or community-based organizations, which have been the main recipients of PEPFAR funding. So it's a very critical kind of discussion about how best to deliver services in communities. And governments have this constant and ongoing kind of question mark of the ability of community-based organizations to deliver quality services. It's rather interesting that they don't seem to place the same high standard on government services. But when it comes to contracting out services to NGOs or providing funding, then it becomes a big issue. So I work at the South African Medical Research Council, and we've been testing different ways of answering government's question about how effectively services can be delivered. And this project that I've been asked to talk about is called a social impact bond. And basically what we do is, in this case, picked up an ongoing, unresolved programmatic problem, which is to deliver HIV and reproductive health services to young women in schools with high HIV incidence and unplanned pregnancy rates. But instead of asking government to pay for this or a donor, what we did is that we went to an investor in the private market and asked them to pay for the program. And as outcomes are achieved in the program, then government buys those outcomes. So what that does is that government only pays for successful outcomes, and the risk of failure or underachievement is carried by the investor. That's the essence of this social impact bond, the way we've structured it. So after 2 years of implementing a program like this, and I only have a few minutes, I have to keep it brief. You know, we've
1 minute left, Doctor. Thank you.
Yeah, so we've had very good outcomes which have shut out the lights, really. High levels of PrEP, contraception, antiretroviral treatment. And in one outcome, which is early antenatal care, outcomes were not achieved, and the risk of that has been transferred to the investor. So in summary, government only pays for successful outcomes, and the investor really carries the risk of poor performance. And when there's underperformance and the investor is at risk of losing funds, then it triggers a whole lot of steps to improve performance. So at the end of the program, the investor gets reimbursed, but is also able to demonstrate social impact. And that's the essence of this. And I guess the main message here is that we do need to try different ways to implement programs in the community that can, guarantee that funds provided by governments are effectively used. So I'll stop there. I think it's a very kind of narrow kind of climax to a much higher level political discussion, but we wanted to share this idea with this meeting as we were asked to do. Thank you. I'll stop there.
Thank you so much, Dr. Abdullah. I would like to spend hours learning from that research, but now we really like have more research like what Dr. Abdullah do to prove or to look at the quality, the impact of the program that the community do, because like he mentioned, there's a question about the quality of the community program, which sometimes they just use argument as an argument to not allocating funding to the community. But nevertheless, we have to deal with that situation, and evidence coming from research, like what Dr. Abdullah is doing, is very important. So I am sorry, but I have to wrap up the conversation here. We are already over time a lot, and it's blame me for that because I cannot I cannot resist listening to people talking. So, but I hope that is only one of the beginning of this important conversation. How can we sustain the community response? There's some idea already shared here. I hope you will carry that with you and build on that and look at it and examine and also have more idea. And watch out to the UNAIDS when they develop the minimum standard, and watch out to the Global Fund as a reallocation, prioritization is happening. Watch out other space, but in the meantime, we work on the domestic resource mobilization, institutionalization in the country. But on the other hand, as we can hear here, we need the independent civil society and community, and the independent sort of funding is needed for that. So we need everyone, and hope that we will see each other again in the different conversation where we have a few solutions that can bring a great result. But I hope you agree with me that we are in the time of change. We are ready for change. How? When, I mean, now, change is now, but how it happened, we need to own shape it. So thank you so much, every one of you, for your participation. And please thank the people who start the conversation today for me. And thank you, everyone who's participated online. And yeah, we deserve a round of applause for all of us. Thank you so much. And I understand that there's a reception outside for the people who are in Geneva. For the people who are online, I hope you can go and get some good drink and some good Thai. Bye-bye.